The trapezius muscle group. The trapezius muscle gets its name from its trapezoidal or diamond shape. This large muscle covers the upper back and posterior neck regions and is composed of three functionally distinct sections: the upper trapezius, the middle trapezius, and the lower trapezius. This muscle functions to position the scapula for shoulder joint movement and also to move and position the head. Here are the landmarks for the upper and middle trapezius. First, we have the cervical and thoracic vertebrae, the scapula, the clavicle, and the base of the skull. The upper and middle trapezius originate on C1 to the T4 spinous processes and on the base of the skull. And they insert on the spine of the scapula, the acromion process, and the lateral clavicle. Contraction of the upper trapezius produces lateral flexion of the neck. Bilateral contraction of the upper trapezius produces neck extension, and contraction of the middle trapezius produces scapular retraction. The sternocleidomastoid assists the upper trapezius during lateral flexion. The posterior cervical group assists the upper trapezius during neck extension, and the rhomboids assist the middle trapezius during scapular retraction. The contralateral upper trapezius opposes the upper trap during lateral flexion, and the SCM, or sternocleidomastoid, opposes the upper trap during neck extension. The serratus anterior and pectoralis major both oppose the middle trapezius during scapular retraction. Now we'll take a look at the lower trapezius landmarks. We have the thoracic vertebrae from T1 to T12, the scapula, and the spine of the scapula. The lower trapezius originates on the spinous processes of thoracic vertebrae T1 through T12 and inserts up on the spine of the scapula. Contraction of the lower trapezius produces scapular depression, where it pulls the scapula downward, and also scapular retraction, where it pulls the scapula inward towards the spine. The latissimus dorsi assists the lower trap during scapular depression, and the rhomboids and middle trap assist the lower trap during scapular retraction. The levator scapula opposes the lower trap during scapular depression, and the serratus anterior and pec major oppose the lower trap during scapular retraction. Clinical findings for the trapezius trigger points. It is extremely rare that I see a client with no active trigger points in the trapezius muscle, no matter what their chief complaint might be at the time of their first visit. Having said this, let's take a look at the associated symptoms for trapezius trigger points. Clients will present with pain on the back and side of the neck, top of the shoulder, between the shoulder blades, back of the head, pain behind the ear, at the angle of the jaw, and in the temple regions. Occasionally, clients may present with a quiver-like sensation in their upper arm. Activating or perpetuating factors for trapezius trigger points include automobile accidents, any activity that requires the muscle to carry the weight of the arm for an extended period of time, forward head, rounded shoulder posture, postural asymmetry due to scoliosis or due to lower limb length inequality, a heavy backpack or a heavy shoulder bag, emotional distress or anxiety, long telephone conversations, sleeping on their stomach with their head turned to one side, playing the violin, arm rests that are too high, holding the arm up and forward for a long period of time, and prolonged bending and reaching forward while sitting. Trigger points associated with the trapezius trigger points include levator scapula, pectoralis major, and scalene trigger points. Clients with active trigger points in the trapezius muscle are commonly misdiagnosed with tension headache, migraine headaches, and TMJ disorder.